Poverty, moving on, is taking a staggering toll on NHS services. That's according to a report from the King's Fund and the Joseph Rowntree Foundation. Their new report shows a direct link between hardship and hospital admissions.
Now, it says that A&E attendance is nearly twice as high in the poorest groups in society, with 8% of lower-income adults saying they'd not collected a prescription because they couldn't afford it. Well, joining us now in the studio is Saoirse Mallorie, senior analyst at the King's Fund, and we're also joined by GP Rachel Ward. Saoirse, what was the aim of this report?
So the aim was really to try and illustrate the impact that poverty has both on people's health throughout the entirety of their lives, and on their use of NHS services, that living in poverty makes it harder not just to enjoy good health, but to access the help that you need for your health.
Rachel, lovely to have you on, both of you. Rachel, we've spoken to you many times before, what's your reaction to the findings of the report? I don't mean this in the wrong way at all, but to me that would make pretty obvious sense. If you live in deprived areas and you're struggling, is it, I guess, more likely that you're going to be having things wrong with you? I mean, is that why the NHS is creaking, or is it one part of many reasons, which would be my opinion?
I think it's interesting, of course, to review these statistics and see where we're at. But I think this is absolutely not new information. So I think actually the bigger question is, why is it that we continue to see such health inequality across the country, yet very little has been done about it? We're in a situation where there is a discrepancy in life expectancy between the richest and the poorest parts of the country of almost 10 years. I mean, that is an incredible figure for a relatively small country. So yes, I absolutely relate to everything in this report, and I see it day in, day out. But I think the biggest question for me is, why is it not being addressed?
Absolutely. We were just talking about the appalling situation with regards to dentistry in the UK. It says here that nearly 1 in 5 low-income adults report skipping essential dental care due to the cost. And, of course, that can then lead on to further health implications.
Cost, or because they can't get an appointment?
Well, both, because, if you can afford it, this is the age-old thing. If you can afford it, you will end up paying to go private. And that's what more and more people are doing, isn't it?
Yes, exactly. This is a major and, in some ways, a growing problem where people are unable to access the services they need at a more timely manner. So, for example, looking at data on hospital-based tooth extractions, major procedures, there's such a huge correlation between that and poverty, which implies that people were not able to access the dental care they needed earlier on, so ended up getting a lot sicker.
And do you think that poverty breeds poverty? So, for example, I'm from an area that's got one of the highest mortality rates in the country, where I was born. And because it's such a poor area, there's lower housing standards, which means there's cheaper housing, which means more people come in with comorbidities and health issues. And so that particular NHS service is completely run to the ground a lot of the time with transient people, whereas in wealthier areas that's still NHS, they've got the best NHS services, and yet they can still afford private healthcare. So it's kind of this vicious cycle, isn't it?
Exactly, yes. It's the people living in poorer areas, in a way, need the NHS even more. And not just the NHS, but, as you mentioned, broader societal help that the NHS can't really provide, like decent housing. The NHS can treat asthma, but it can't sort out if your house is full of mould.
Yeah. Listen, we all want more houses, but that never happens because MPs ask their own constituents who say we'd like that, but not in our constituency. Just quickly, Rachel, really interesting, and it seems particularly obvious, and I think you're absolutely right. I think Saoirse understands that as well. What other things cause bad health? I mean, I asked you the question before. I'm trying to look at all sides of this argument. We hear the argument again and again about how the NHS is run down. And I take Nicola's point, actually, it's interesting, in different areas across the country. Could the NHS do anything differently, in your opinion, as a GP, to spend the money better or not? Is it all about money, or is it about changing the way things are done?
I think it's about actually appropriately funding the services. You made a very interesting point, Jeremy, about dentistry services saying, you know, dentists are leaving and that's the problem. Actually, that's not the problem. The problem is that the services are funded at a level that they're not viable businesses. And I'm seeing this in GP more and more. So GPs across the country are going bust. GPs, the irony of the fact that we don't have enough GPs, but GPs are currently being made redundant because the service is not appropriately funded to make it viable. So yes, there is an issue with not having enough people around. It's because it's not a viable model. So actually the money needs to go into these primary services appropriately in order to make them sustainable, in order for us to then do the work in these hard hit areas. And we can do it. We've got the evidence that we can really make a difference in these areas. Give us the tools, we will do the work. But at the moment, we don't have those tools.
Well, thank you so much,
Yeah,
both of you, for joining.